Hello, we are the next group. We are studying the effect of stay-at-home orders on the growth rate of COVID-19 cases. I'm David Rice and joined by my colleagues John Garber and Keegan Line. We are from the Department of Mathematics at Western Washington University, and our advisor is Kimihiro Noguchi. And so for some background, to reduce the rate of COVID-19 infections, many state governments in the US implemented stay-at-home orders that often happened at different times. Our project investigates whether these stay-at-home orders had a significant effect on the reduction of infection rate when considering the various demographic factors. So we utilize publicly available data from the following sources to reach our conclusion. And so all the data were collected on the county level among all US states. 134 counties were selected based on the following criterion. These counties had at least 5 days with over 100 total cases before the stay-at-home order took effect, recorded as of May 22nd, 2020, which is when we did our project. So out of these 134 observations, 100 of them were randomly selected to train our models. The remaining 34 observations were used for testing the models. So the three models we are built based off of the data set: the classification regression tree, the random forest, and the lasso regression.
Yeah, so our response variable was if a county had a large or small decrease in the average daily growth rate. And the way this was computed was by getting a daily growth factor for each day and averaging the entire pre-stay-at-home period and the post-stay-at-home period. So as you can see on the top, we kind of have the date by date number of cases, and then we just calculated those growth rates from one day to the next. And on the bottom left, you can see the average pre-stay-at-home period for each county. And then on the middle column, you have the average post-stay-at-home period. From these, a difference was taken from the pre and post growth factors to make a growth rate difference. So that was the pre minus the post to make that decrease in growth rate. In the end, we ended up ranking the decreased by high or low, split by the median decrease. So why the response? We did a pre and post comparison because without it, we ended up just seeing a correlation between staying at home and total confirmed cases. So usually we would end up with a situation where you would see that the counties with less cases, relatively less cases, would end up going out more and having shorter stay-at-home periods. And that was pretty much all we got out of that model. So by implementing that pre and post comparison, we were able to see the effect of the stay-at-home orders within each county on their own terms. So, okay, yeah, and because for small numbers, growth rates were exaggerated, so we needed to use time points that had at least 100 cases for at least 5 days in the pre-period. So on the top left, you can see that Livingston, Michigan on those dates went from 1 case to 3 cases, which ended up being a growth factor of 300%, which definitely kind of throws off that average growth period. So we didn't want to include those because it just made it look way too big. So on the upper right, Middlesex, Massachusetts, you see that when it's above 100, you end up seeing growth factors that make a lot more sense and are a lot more reasonable to consider. Yeah, and another thing is we saw that the post average was always less than the pre stay-at-home period average. So we wanted to rank how fast that decrease occurred in order to kind of rank the effectiveness of that stay-at-home order.
All right, and so for the predictors we use for our model, we looked at the days since stay at home, the days since the first case in the county, the total population of the county, the percentage of the county over 55, the per capita income, and then the movement data, which was aggregate data collected by Google, which measured where people went around in their community. There was a 5-week period in January where a baseline was established of how people moved around in their given communities. And then every measurement afterwards is a deviation from that baseline as a percentage. So if we had like a number 5, that would mean we went to groceries 5% more than we did in that period in January. And so for the CART model, the classification regression tree is built by recursive binary splitting of the data by identifying variables that best achieve classification. As you can see, we have the day since stay-at-home order is one of the variables we use to split the data, with being less than 51 days, corresponding to a small decrease in cases, and eventually going through these decisions, getting to a large decrease in cases here. And so this shows the days in stay-at-home order and the grocery and pharmacy are significant variables.
The Lasso regression is a regression that shrinks all the unimportant variables to zero by controlling the penalty parameter, and then variables with non-zero coefficients are considered significant. As you can see by the chart on the left, days in stay-at-home and residential are both considered important, and because they're positive, we can see that they have a positive effect on the decrease in cases.
And so for the random forest model, a random forest decision is made by aggregating the decisions of the smaller CART models, as we just saw in the previous slides. Each smaller CART model is made from a random subset of the data with replacement and a limited number of random predictors. We chose 3 in our case. So while individual CART model provides a better interpretation of the results, the random forest gives a lot better prediction accuracy while providing a reasonable interpretation of the model. So the number of trees in the random forest can be determined by examining the out-of-bag error rate.
The out-of-bag error rate is the classification error caused by data that is left out of each training set for the random forest. The graph shows that the minimized point is at 640 trees, and that's around 22.4%. The sensitivity rate, or the rate that we correctly predict large decreases in infection rate, is 78%, and the specificity rate, or the rate at which we correctly predict small decreases in infection rate, is 74%. And as you can see by the variable importance chart of the random forest, higher up a variable is, the more important it was. Days since stay at home, grocery and pharmacy, and residential change are all high up, which means they're all important variables in making those trees.
And so this demonstrates that the longer the stay-at-home order and lower movement have a significant effect on the decrease of average growth rate of cases, and these results are consistent across all the models. Some limitations, the data was taken earlier in the pandemic, and so we don't necessarily know if any of the trends have changed as more data has been collected. We excluded many counties based on lack of data and low case counts. For the counties with less than 100 cases, we cut those from our data set, and for counties that did not include some of the Google movement data, we cut those as well. The Google movement data were based on January movement, and so we don't necessarily know if that doesn't account for seasonal effects, such as people going to the park more naturally in spring than January, which could cause some mix-ups. The census data was taken from the 2010 census. We don't necessarily know if there were a change in demographics since then. And different time slices were used for each county. And so because our data set was based centered around when the stay-at-home order was implemented, some counties may have had different amounts of information about the coronavirus simply because they implemented it later on, and so that might have changed. And we have questions.